ABC4 News at 4 starts now.
Stress, lots of us are feeling it right now, and that includes children. So coming up, we speak with a clinical social worker about how to reduce the tense feelings right there in your household. Well, we keep hearing that this is an unprecedented time. Every day seems to bring more announcements of the unknowns.
Yeah, and all of this causes significant stress, especially for adults taking care of both young children and worrying about aging parents. Licensed clinical social worker Jillian Payan joins us now live from West Covina. Thanks for being with us here. We've been talking a lot about the feelings of anxiety. What are some things you can offer us? Because obviously anxiety tends to feed off, one person in the family can certainly share that with others.
Of course. Hi. Well, thank you for this. I just want to express something. So mental health is going to be a very important thing for us to focus on, our emotional well-being. We can do some coping skills, make some routines, a lot of self-care, because we're going to be taking not only care of ourselves, but of our families as well.
Let's talk about those routines you mentioned. Can you give us specifics, especially when it comes to children?
Sure, of course. So some children's routines, let's think about it. They're in school Monday through Friday. They're with their teachers. They have a routine for their subjects, their academics, their physical education, and their lunch times. So I think it's going to be very important for us to create a routine for the children to help them feel secure and safe in this time, educate them on what's going on, answer their questions, and really maybe have them help make that routine for themselves. Put it up on a wall, have it visible for them. Have that academic time, have that time to have their lunch, maybe play in their backyard if that's accessible for them, just so that this becomes something normal for them.
You mentioned routine is also important for adults. Should we also put our own schedule up next to our children's? Would that be helpful perhaps?
That would definitely be helpful. It's a change for all of us. This is a time of adjustment. So making a routine for us adults as well, writing it in the calendar, adjusting to our child's schedule. They're going to be home now. Maybe we're working from home. So creating these schedules will be helpful to reduce some of that feeling of being overwhelmed or that stress that we have. Parents, it's going to be important to implement these self-care routines as well and put that in the schedule for not just yourself, but for your children as well.
Let's talk about over the next few weeks here. You mentioned coping skills. Is there a universal set of coping skills, or does it vary from child to parent, from parent to child?
It does. It varies from everybody. It depends on what that person enjoys. Some coping skills can be things like maybe being creative, having some art activities, going outside in your backyard and doing some exercise, going for a walk as long as you follow the guidelines for the Center for Disease Control, and even just maybe doing some yoga, some meditation. We can look up some things on YouTube and get some ideas, some resources. But it's going to be important to implement those things and just doing things that we enjoy again.
A lot of parents are worried both about their children and perhaps their parents. What's the importance of self-care here going forward?
It's going to be extremely important, and it might be something that we prioritize because, remember, we have to be healthy in order to be healthy for our children and our families. So being the caregiver, taking care of our older adults, making that time, like I said, putting that self-care in that schedule and really making it a routine to, when you're tired, rest, when you're hungry, eat, when you stay hydrated, and implement these routines for yourself so that we always have that self-care time.
All right, Jillian, we appreciate it. And of course, remember to breathe.
That's good advice too, Michael.
Yes, definitely. Thank you.
All right, appreciate it. Thank you so much.